everybody. In this episode, we're going to be discussing a paper that looks at the guidelines for handling contact lenses in a clinical setting. And our guest expert for this episode is Dr. Melissa Barnett, who's the Director of Optometry at the University of California, Davis, and hosts her own podcast, Clearly KC, with the National Keratoconus Foundation. Thanks for joining us on our podcast today, Melissa.
Thanks for having me.
So today we're going to discuss a article from Optometry and Vision Science called Technical Report, Guidelines for Handling of Multi-Patient Contact Lenses in a Clinical Study by Christine Sint and colleagues, including Dr. Barnett, which again was published in the Academy's Journal. So I am old enough, experienced enough to remember the days where we used to prescribe yearly contact lenses in little vials. And at the end of the day, we threw them all in a heat disinfection unit and ran that at the end of the day. And generally speaking, we aren't doing this anymore for soft lenses since we've moved on to a more, disposable market, although we still see this for rigid contact lenses and hybrid lenses, and I suppose maybe more custom soft lenses. But what are your thoughts in this area?
Yes, well, you're wise enough. You're not old, you're wise. So as eye doctors, we obviously don't want to infect our patients' eyes, and we need to consider all sorts of things like bacterial, fungal, viral, parasitic, and other transmissible pathogens. And remember, it's not just the lens itself. So yes, there are rigid lenses, there are hybrid lenses, there are custom soft contact lenses, but there are also the cases and solutions and devices like applicators for scleral lenses. So in some cases, of course, we can fit empirically and use disposable lenses. I mean, the soft lens market has completely changed since those days, but sometimes it's not always possible when we're dealing with custom lenses, for example, when we're fitting scleral lenses. Now, the thing that you have to know about this study is that we actually started on this prior to COVID. So yeah. So years before, actually, and the timing is kind of interesting of the publication.
It is, isn't it? So what exactly is this paper looking at?
So we're looking at best practices for reusing contact lenses in clinical practice. So anything that is reusable, so that could be a soft contact lens, any sort of rigid lens, a corneal gas permeable lens or a scleral lens, and hybrid lenses as well. So it gives specific recommendations for everything, as well as documentation for how to document everything as far as disinfection of contact lenses and storage of contact lenses.
Now, already I can tell we didn't used to do things as well as you've just described, because we certainly didn't document things way back then. And we can't get into all of the nitty-gritty details, but can you give us some ideas of general best practices that are discussed in the paper?
Sure. And this is based off of ISO guidelines as well. So patients who have an active infection, an HIV infection or herpetic infection, we need to dispose of the contact lenses immediately. And we need to treat the lenses like biohazards. So using gloves, taking off the lens with a glove and disposing of them in biohazard waste. It's important to practice good hand hygiene. I know we talk about good hand hygiene all the time, but that means completely drying hands after washing them, teaching staff good hand hygiene, and informing staff of the expiration dates for all of the solutions used in clinic as well, not only for the contact lenses, but solutions in general. So it is actually quite a process, but it's really nice because there's a one-page sheet from this paper that we have in our clinic that you can just download this free of charge. And we have that sheet because it goes over exactly what to do for each type of contact lens, and we have that as a reference.
Beautiful. So one of the things that I noticed in the paper was talking about contact lens cases specifically, and I don't think that was something that was ever emphasized, even in the days when we were commonly doing this. So can you talk to us a little bit about best practices for contact lens cases?
Oh, goodness. Replace the case. I mean, if you can, replace your case with every new bottle of solution. Just this is in general, right? So every 3 months. Clean applicators. You can clean applicators daily, which would be wonderful, either with alcohol or with a multi-purpose solution. When disinfecting lenses, use a disposable case. Of course, cases are easy to find, so use a disposable case and throw it away. So for example, with gas permeable lenses, including scleral lenses, using a flat case, putting hydrogen peroxide in that case, letting it sit for 3 hours or longer, will completely neutralize the lens, and then you can just dispose. You can also recycle the case. And using similar techniques for different types of lenses, but this paper provides really good guidelines of exactly what to do for each type of reusable contact lens.
So maybe what the last question I'll ask you is, do you have any other tips for implementation in your own offices? I love the idea of printing out that one-page guideline from the paper, but are there any other tips you want to give our audience?
Yes, a big tip, which I find that many doctors are not doing, is storing gas permeable lenses dry. So we don't want to be storing lenses in solution. We don't want bacteria to build up in that solution. We want to store the lenses dry. So that is a huge tip. It's in the paper, but a good best practice as well.
Wonderful. Well, thank you so much for joining us today, Dr. Barnett.
Thank you.